And fueled by the coronavirus pandemic and an increase in fentanyl use, records show the U.S. drug epidemic exploded while Americans were locked down in their homes. According to data released by the U.S. Centers for Disease Control and Prevention, from May 2020 through April 2021, more than 100,000 people died from drug overdoses in the United States. Now, that's near a 30% rise from the same period just a year ago. The drug epidemic grew in tandem with the COVID-19 pandemic, which claimed about 509,000 lives in the same period. Synthetic opioids like fentanyl, a painkiller 50 to 100 times more potent than morphine, accounted for the bulk of drug overdose deaths, put at about 64,000. And from San Antonio, Texas, in the United States, a pediatric cardiologist, Wale Olabiyi, joins me now via Zoom to discuss this drug overdose crisis. Good to have you join us, Dr. Olabiyi.
Good afternoon. Good to be here. Thank you.
So we understand that the pandemic has been largely blamed for this rise in deaths and opioid use. But we also know that in the U.S., there has been a systematic increase over the years in terms of drug use and drug-related deaths. Apart from the pandemic, what else do you think is fueling the drug abuse crisis or the drug use crisis in the U.S.?
Yes, you're correct. Drug use and opioid use has been on the rise in the U.S. even prior to the pandemic. Fentanyl is a synthetic opioid that's stronger than morphine, 50 to 100 times stronger than morphine. And it can be made easily by people who know how to make it in a lab. So the availability of it to be easily made, it being very strong, it being very addictive, causes it to be very, to become more of a problem. Sometimes people mix these drugs in with other illegal drugs like marijuana, cocaine, or heroin. And the people that are using it do not know they're using fentanyl. And they become hooked on it during that time, and all of a sudden, now they cannot get off of it, and now becomes something that they're permanently hooked onto. And that causes more addiction, and that causes more dependency on it, and then that fuels that whole fuel of the increased use and the increased dependency and the increased amount of deaths. Because if you mix up a batch of fentanyl and you mix it up wrong and you put it into someone else's marijuana, that can cause sudden death. And that person might not know they're even taking fentanyl. They might think they're just smoking marijuana or using something else.
So talk to us about fentanyl, because it does seem like it has always been there, but it does seem like it is now the biggest cause of death. And it is a synthetic opioid, I understand, but how does this work, and how is it? We also understand that now that it is very ubiquitous, which means that anyone can get it anywhere. How did this become a crisis in the U.S.?
You're right. It's been around for a long time. We use it in the OR. We use it for cancer patients. We use it as a controlled medication for children, adults, and it's a great medication when it's used appropriately. But it's also available for people that are home, like people that use it for patches and things like that. If it's in a patch, it can be pulled out of the patch, and people can use it to make a synthetic drug for themselves at home. But sometimes that is not a well-controlled environment, so they don't know exactly how much they're getting. So because it's available at home and it can also be made synthetically, people sometimes sell those drugs illegally to other people. Sometimes some people make fentanyl at home or in labs and sell that. So the combination of it being available where people can sell and distribute, and people can also make it, and it's very addictive, has made this perfect storm where adding that into the pandemic becomes a real big problem, where people are at home, depressed, using drugs, things like that, and add something that's very addictive, very powerful, and has a ability to slow your heart rate down, slow your breathing down, cause respiratory compromise, and sudden death. And it's very addictive. So you can start using small doses and you don't know you're using it, and all of a sudden you're now addicted to it. And you have to, now you start looking for fentanyl, because even the original drug you were trying to take initially cannot give you that fix that fentanyl does. So it's a very bad mix of combinations that becomes a real issue and can cause, and has led to this new epidemic of sudden deaths that we've seen on the opioid market.
Absolutely, and it's not just in the U.S. alone. Even here in Nigeria, we see that the Drug Law Enforcement Agency seems to be battling with this crisis as well. But let's look at the case in Washington, where Washington State has filed charges against pharmaceuticals who make these drugs in the U.S., saying that they should claim a level of responsibility when it comes to the addiction and the deaths. In previous cases, they have been acquitted that they do not have to bear responsibility. The responsibility lies with the user. But where do you stand? Should pharmaceuticals take a level of responsibility in this drug addiction that is becoming a global problem, not just even in the U.S.?
I think they have their own level of responsibility involved in it, because these medications were at one point in time distributed as not having as much of a dependency or addiction compared to heroin or things like that. But it's actually as strong, or if not stronger, in those dependencies. So they do have some level of, they're a little bit involved in it also. So they have to take some level of, they're part of it, right? So I think they in all, they've been acquitted in the past, but I think in the future, you're going to see some cases where they're actually held liable. So I think at the end of the day, as we keep watching these cases and they're coming out, they're going to be held liable for some of it. The end user does have their own, they have to take, they have to take responsibility for what they used also, but the drug companies have some responsibility in teaching and educating people about what they're about to take. So that the regular general public that's taking it does not get dependent on it. Now, they don't have anything to do per se about the people that use it illegally. So in that case, I don't think they have any liability for people who use it illegally. But people who use it in a legal form and get dependent on it, I think the drug manufacturers do have some, they do have some liability in that.
So I have a lot of questions to ask you, but because I have little time left, I'm trying to figure out which should come first. I know that it is a global problem and countries are looking for how to deal with this. So I'm looking to ask you how angle that we can take this from. But I just also want to focus on the individual. A lot of people are getting addicted to drugs, especially during the pandemic, where people felt alone and in their own homes. People who were abused by husbands, by wives, by caregivers, and all of that became addicted to drugs. And it also has social and economic social and economic factors. People who are struggling with depression, struggling with job loss, and all of that. So let me ask you. At what point do you realize that, look, I'm having a problem? People take drugs generally for one pain or the other, but at what point do you begin to realize that, look, there is a problem, maybe I need to seek help?
So if you're taking a drug that's been prescribed to you and it's for pain or for back pain, shoulder pain, something like that, normally you should just take it and it should be able to do what it does to solve the pain. But if it's starting to become a thing that you're looking for, that extra feeling, that sudden high that comes with the drug, then you might be treating something else, more of an emotional thing. So it's very key to make sure that you look for psychiatric help or psychological help. Look for counselors, look for somebody you can talk to the doctor that's prescribing this for you, because this can lead to a real dependency where you are dependent on the drug that you actually were supposed to just take for back pain, and now you're seeking higher doses, you're seeking more doses of it, and it becomes a real problem where you're taking an opioid and it becomes an issue. Nowadays, a lot of anesthesiologists and a lot of doctors that treat pain and pain management are trying to use things like tramadol, things that have less of a dependency, and so that people don't get as dependent on those medications at home. And you also have to watch things like your breathing. If you, at any point in time, you're taking any kind of medication and your heart rate's dropping, your breathing is getting difficult, then you know that you're definitely having a side effect on a bad situation, that you probably should talk to somebody or seek immediate medical help. Talk to your primary care doctor, talk to your cardiologist, and people like that. But at the base of it is the emotional and psychological help. If you're depressed, if you're feeling lonely, if through the pandemic, a lot of things have been going on, like you're talking about home abuse and battered homes and things like that, then you definitely need to seek some help, a shelter if possible, or seek some help from some governmental organizations or non-governmental organizations that are available to you.
And from what angle can governments begin to tackle these crises, really? Because, okay, in the US, it is opioid, it is fentanyl. Cocaine is a general problem. Heroin is a general problem. We also have the problem of tramadol and just other cough syrup in Nigeria. From what angle can governments begin to tackle this crisis?
Government can begin to tackle the crisis by educating the people, first off, and also providing resources. In the US, some of the things that they do is they actually provide clean needles, which sounds kind of crazy. They provide clean needles so that people don't transmit HIV to each other. And in those centers, they actually provide fentanyl testing strips to be able to test the other drugs you're using to make sure it doesn't have fentanyl in it, so that you don't get addicted to it. That's to prevent you from going into the super worst side of it, and the government can provide those kind of resources. The government can now provide education and help for people that are dependent on drugs to help get them off, where they can use things like methadone to help, like methadone clinics to help get them off of those hard opioids and hard narcotics and things like that. So the government has a lot of role to be able to play to help get people off of those medications and not stigmatize it. Know that it's a condition like diabetes and things like that has to be treated. If you want to be able to have people that are essential in the economy and helping out, we have to bring those people out of the addiction. It costs us both economically and costs us socially. If people are addicted to drugs, they can't be effective members of society, they can't help in the society, and actually becomes a bigger cost, and it also becomes emotional crisis if they die or something happens to them. So it's very important for both the governments to be involved and other people and other organizations like churches and mosques, things like that, to help people out.
Pediatric cardiologist Wale Olabiyi, thanks for your time and your insight.
Thank you very much. Thanks for having me.